9 warning signs in your feet that could mean diabetes. Don't ignore these early signals. Have you ever looked at your feet and felt something was off but ignored it? For many people over 50, the feet quietly reveal what's happening inside the body long before serious illness appears. A small change in color, a strange numbness, or a wound that won't heal may not seem urgent, but these could be early warning signs of diabetes. And the truth is, the earlier you notice them, the more you can protect your health, your mobility, and your independence. This is not just about your feet. It's about your future, your freedom, and your quality of life. Before we continue, take a moment to care for yourself. Tap the subscribe button, like this video, and share your thoughts below. Someone else may need this information too. Staying informed today can help you or a loved one avoid serious complications tomorrow. Let's take this journey together. Persistent numbness or tingling in the feet is often described as a pins and needles sensation that does not go away. In adults over 50, some doctors warn this may be an early sign of diabetic nerve damage, also known as peripheral neuropathy. When blood sugar levels remain elevated over time, they can begin to injure the delicate nerves, especially in the feet where circulation is already more vulnerable. At first, the feeling may come and go, especially at night or after sitting for long periods. Research shows that many people ignore these early signals because they are not painful. However, as the condition progresses, the nerves lose their ability to send clear signals, leading to reduced sensitivity. This means small cuts, blisters, or pressure sores may go completely unnoticed. Doctors often emphasize that loss of sensation is more dangerous than pain because it removes the body's natural warning system. Without that signal, minor foot problems can quietly develop into infections or ulcers. In people with diabetes, healing is already slower, which increases the risk of complications. Paying attention to persistent tingling is important. It is not just discomfort, but a sign that the nerves may already be under stress. Early medical evaluation can help identify blood sugar issues before more serious and irreversible damage occurs. Some observations suggest that earlier detection and management of glucose levels can slow nerve damage and protect foot health, preserving mobility and independence in later years. When prevention becomes far more important than treatment, slow healing cuts or wounds on the feet are a warning sign that should never be ignored, especially in adults over 50. When a small cut, blister, or sore takes longer than usual to close, some doctors warn it may point to poor circulation or elevated blood sugar levels. Both of these conditions can interfere with the body's natural healing process, making even minor injuries more serious over time. Research shows that high glucose levels can damage blood vessels, reducing the flow of oxygen and nutrients needed for proper healing. At the same time, the immune response may become weaker, making it harder for the body to fight off bacteria. This creates an environment where wounds remain open longer and are more likely to become infected. In many cases, a simple blister caused by tight shoes or minor friction can gradually worsen without proper healing. Doctors often note that people may not feel the severity of the wound if nerve sensitivity is reduced, allowing the injury to go unnoticed and untreated. As a result, what begins as a small issue can develop into a deeper infection or even an ulcer. Medical experts emphasize that delayed healing is not just a surface problem but a sign of internal imbalance. Early evaluation can help identify whether blood sugar levels are contributing to the issue. Addressing the cause in time can prevent complications, protect the feet, and reduce the risk of more serious outcomes that may affect mobility and overall health in later years. A burning sensation in the feet that does not fade, especially during the night, can be an early warning sign that should not be ignored. Some doctors warn that this feeling is often linked to nerve irritation caused by elevated blood sugar levels, a condition commonly associated with developing diabetes. The nerves in the feet are particularly sensitive, and when exposed to prolonged glucose imbalance, they may begin to send abnormal signals such as heat, tingling, or sharp discomfort. Research suggests that this burning feeling may start mildly but can gradually intensify over time if the underlying cause is not addressed. Many individuals report that symptoms become more noticeable at night when the body is at rest, making it harder to fall asleep or stay asleep. Poor sleep, in turn, can affect overall health, mood, and energy levels, especially in older adults who rely on proper rest for recovery and daily functioning. Medical experts often explain that this sensation is part of peripheral nerve stress, where the communication between nerves and the brain becomes disrupted. As the condition progresses, the discomfort may spread or become more constant, affecting quality of life and limiting daily activities. In some cases, sensitivity may increase to the point where even light touch feels uncomfortable. Paying attention to a persistent burning feeling is important because it reflects internal changes that may not yet be visible. Early recognition and proper evaluation can help manage blood sugar levels more effectively, reducing further nerve irritation and helping maintain comfort, mobility, and long-term well-being in later years. Changes in skin color on the feet, whether the skin appears unusually red, bluish, or pale, should never be ignored. Some doctors warn that these color changes can be an important sign of circulation problems often linked to diabetes. When blood sugar remains elevated for long periods, it can damage blood vessels and reduce healthy blood flow to the lower legs and feet, making these visible changes one of the body's earliest warning signals. Research shows that healthy circulation is essential because it delivers oxygen and nutrients to the tissues. When blood flow becomes restricted, the feet may not receive enough oxygen to maintain normal skin color and tissue health. Redness may sometimes indicate inflammation or pressure, while bluish tones can suggest reduced oxygen levels. Pale skin may signal that blood is not reaching the area properly. Medical experts often note that poor circulation tends to develop gradually, which is why many people dismiss these color changes as harmless. However, when ignored, reduced blood flow can increase the risk of slow healing, skin breakdown, and infections. In more advanced cases, long-term tissue damage may occur, affecting mobility and comfort. Doctors frequently encourage adults over 50 to pay close attention to persistent color changes, especially if they appear alongside numbness, coldness, or discomfort. These visible signs may reveal internal circulation issues before more severe complications develop. Early medical evaluation can help determine whether blood sugar imbalance is affecting circulation. Recognizing these changes in time allows for proper management, helping protect the feet, preserve tissue health, and support independence and movement later in life. For many older adults, swelling in the feet and ankles that appears frequently or without a clear reason should not be ignored. Some doctors warn that this type of swelling, also known as edema, may be linked to fluid retention or poor circulation, both of which can be associated with diabetes. When blood sugar levels remain high over time, they can affect the function of blood vessels and the balance of fluids in the body, leading to visible puffiness in the lower extremities. Research suggests that poor circulation makes it harder for blood to return from the feet back to the heart, causing fluid to collect in the tissues. This can result in tightness, heaviness, or a feeling that shoes no longer fit comfortably. In older adults, these subtle changes may be dismissed as a normal part of aging, but doctors often advise paying close attention when swelling becomes persistent. Medical experts also note that ongoing swelling can place extra pressure on the joints, making walking and standing more difficult over time. Reduced mobility can affect balance and increase the risk of falls, especially in individuals already dealing with nerve sensitivity or weakness. In some cases, swelling may also be accompanied by skin changes or discomfort, which can signal a deeper issue. Doctors emphasize that identifying the cause of swelling early is important. When linked to blood sugar imbalance, proper management can help reduce strain on the circulatory system. Addressing this symptom in time supports better movement, protects joint health, and helps maintain independence and daily comfort in later years. For many older adults, dry, cracked skin on feet, especially around the heels, should not be ignored in adults over 50 because it can be more than a simple skin issue. Some doctors warn that when the skin becomes excessively dry or splits, it may create small openings that allow bacteria to enter the body, increasing the risk of infection. Research suggests that in people with diabetes, nerve damage can reduce sweat gland function, leading to decreased natural moisture in the skin. This lack of moisture makes the skin more fragile and prone to cracking, particularly in pressure areas like the heels. Medical observations show that reduced nerve function in the feet can also lower awareness of dryness or minor injuries, meaning cracks may develop and worsen without being noticed early. When these cracks deepen, they can become painful and may take longer to heal due to reduced circulation and slower skin repair processes often seen in elevated blood sugar conditions. Doctors often emphasize that dry, cracked skin is not only a surface concern but also a potential entry point for infection if left untreated. Over time, repeated skin breakdown can increase the risk of complications that affect mobility and daily comfort. Paying attention to persistent dryness, especially when it does not improve with basic care, can help identify underlying health issues earlier and support better foot protection in later years. Early recognition and proper skincare guidance can significantly reduce complications and help maintain healthier, more resilient feet in older adults. Overall health: loss of hair on the toes or feet that happens gradually should not be ignored, especially in adults over 50. Some doctors warn that this subtle change may indicate reduced blood flow to the lower extremities. When circulation becomes weaker, the small blood vessels that nourish the skin and hair follicles receive less oxygen and nutrients, which can lead to thinning or complete loss of hair in these areas. Research shows that healthy blood circulation plays a key role in maintaining skin and hair health. When circulation is compromised, the body naturally prioritizes vital organs, reducing supply to peripheral areas like the feet. Over time, this reduced supply can cause noticeable changes such as smooth, shiny skin and decreased hair growth. Medical experts often point out that this sign is frequently overlooked because it does not cause pain or immediate discomfort. However, it can be one of the earliest visible indicators of vascular changes that may be linked to diabetes or other circulatory conditions. As blood flow continues to decrease, other symptoms such as cold feet, slow healing, or numbness may also begin to appear. Doctors emphasize that noticing these small changes early is important because they reflect internal circulation health. When linked to blood sugar imbalance, early attention can help prevent further vascular damage and support better foot health. Recognizing the subtle sign allows for timely evaluation, helping protect mobility, reduce future complications, and maintain overall foot function in later years. For older adults, thickened or discolored toenails should not be ignored, especially in adults over 50, because they may indicate an underlying fungal infection. Some doctors warn that these infections are more common in individuals with elevated blood sugar levels, as high glucose can weaken the immune system and create an environment where fungi can grow more easily under the nails. Research shows that fungal nail infections often begin subtly, with slight changes in color such as yellowing, white streaks, or darkening of the nail. Over time, the nails may become thicker, brittle, or distorted in shape. These changes can make regular nail care difficult and may cause discomfort when walking or wearing shoes. Medical experts note that in people with diabetes, reduced circulation and slower immune response can allow infections to progress more quickly. What starts as a small change in one nail can gradually spread to others if not addressed. In some cases, the surrounding skin may also become irritated or infected, increasing the risk of further complications. Doctors often emphasize that nail changes are not just cosmetic issues but potential indicators of internal health conditions. Early attention can help prevent the infection from spreading deeper or becoming harder to treat over time. Proper evaluation can determine whether blood sugar imbalance is contributing to the problem. Recognizing thickened or discolored toenails early allows for timely care, helping maintain foot hygiene, reduce discomfort, and prevent complications that could affect mobility and overall foot health in later years. For older adults, foot pain without any obvious cause should not be ignored, especially in adults over 50, because it may be linked to internal nerve or circulation problems. Some doctors warn that when pain appears without injury, strain, or visible damage, it can sometimes be an early sign of underlying conditions such as diabetes-related nerve changes or reduced blood flow to the feet. Research suggests that nerve damage caused by prolonged high blood sugar can lead to abnormal pain signals, including sharp, dull, or aching sensations that seem to come and go. At the same time, poor circulation may reduce oxygen supply to the tissues, leading to discomfort even during rest. These internal changes often develop slowly, making the pain easy to dismiss at first. Medical experts note that unexplained foot pain can vary in intensity and may become more noticeable at night or after long periods of activity. Over time, this discomfort can affect walking patterns, balance, and overall stability. When mobility is reduced, it can gradually impact independence and daily functioning. Especially in older adults, doctors often emphasize that pain is a signal from the body that something may not be functioning properly. When there is no clear external cause, it becomes even more important to evaluate internal health factors such as blood sugar levels and circulation. Early attention can help identify the root cause before the condition progresses. Recognizing persistent foot pain early allows for timely medical assessment, helping to protect nerve health, improve circulation, and maintain mobility and quality of life in later years. For older adults who depend on strong foot function for daily activities, thank you for spending these few minutes here. Growing older does not mean giving up strength and comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.